What are the exact early warning signs of diabetes?
Increased thirst, increased appetite, loss of weight, dizziness, and peripheral numbness and tingling sensations. Also, it may present with non-healing wounds.
What do the numbers on a sugar machine actually mean?
The fasting sugar more than 126 or the post-lunch sugar more than 200 is called diabetes, and the hemoglobin HbA1c more than 6.5 is called diabetes.
So what is a HbA1c test and how is it different from a daily sugar check?
HbA1c gives an average of the last 3 months of sugar control. Many times it happens that the person's fasting and post-sugar levels are absolutely normal, but the HbA1c is high. So it helps us to detect the people who try to get the sugar levels near normal levels when they come to us and they cheat on us, saying that they have been having a good control, but the HbA1c gets us to know that they have been not loyal to themselves.
Taking insulin means that diabetes has become very bad.
No, that's not true. Starting the patient of insulin means the patient's insulin reserve is exhausted and we are replacing the hormone which is not produced in the body.
How does being overweight increase the risk of diabetes?
Overweight means there is increase of fat around the belly. Now this increased fat causes insulin resistance, which in turn raises the blood sugar levels.
Hello and welcome to Diabetes Talks, a podcast dedicated to diabetes. I'm your host Aman Malhotra, and today we are going to be discussing a topic that affects millions: diabetes. Joining us is a renowned physician with expertise in diabetes and cardiac care, Dr. Prakash Rai. So let's begin the conversation.
Hi, I'm Dr. Prakash Rai. I'm a physician practicing at Andheri West since the last 30 years. I'm specialized in diabetes and cardiac care. I'm attached to Holy Spirit Hospital Andheri since the past 25 years, and I'm also a DNB instructor since the last 12 years.
So Dr. Prakash, what exactly is diabetes and why does it happen in the body?
Diabetes means there is high level of sugar in the blood. Normally, the blood sugar is pushed into the cells by insulin. What happens in diabetes is the insulin is either not produced adequately or the insulin is not acting properly, what is called as an insulin resistance. If the insulin doesn't act properly and the sugar doesn't go into the cells, it will remain in the blood for a longer time, and that's why it damages the blood vessels of the heart, eyes, kidneys and nerves, leading to long-term complication. Luckily, because of the early diagnosis of diabetes, we are able to control the sugar levels at a good pace and control the complications of diabetes.
A lot of people don't know what is the exact difference between type 1 and type 2 diabetes in simple terms.
In type 1 diabetes, which is commonly seen in children and young adults, there is totally destruction of the beta cells of the pancreas, so there is no production of insulin at all. In such a case, the person will be requiring insulin throughout his lifetime. Whereas in type 2 diabetes, the pancreatic cells produce insulin, but the insulin is not acting properly because of the insulin resistance. And over a period of time, the pancreas gets exhausted and there is relative insulin deficiency. So these patients can be managed with lifestyle changes, diet control, exercises and medications. And this may also need insulin at a later stage.
So doctor, as we all know that prevention is better than cure. So what are the exact early warning signs of diabetes?
The early signs of diabetes is increased thirst, increased appetite, loss of weight, dizziness and peripheral numbness and tingling sensations. Also, it may present with non-healing wounds.
So doctor, a lot of people want to know, can diabetes actually be cured or is it a lifelong condition that can only be controlled?
As I said earlier, type 1 diabetes is because of the lack of beta cells in the pancreas, so definitely it cannot be cured. As far as the type 2 is concerned, there is a relative insulin resistance and over a period of time there is exhaustion of the beta cells. So initially, with good diet, exercise and medications, the sugars can come under control. And in the early stages, they may be off medications too. But then we have to regularly monitor the sugars. Otherwise, later on, they'll again land up with high sugars. And that's why regular monitoring of sugars is important.
So, doctor, what exactly can happen to the various organs of the body if diabetes remains uncontrolled for many years?
The presence of high blood sugar can lead to various complications. These are divided into microvascular and macrovascular complications. In the microvascular complications, the small blood vessels of the eyes, the kidneys, and the hearts get affected. If it affects the eyes, it leads to a condition called diabetes retinopathy, where the person presents with diminished vision. If this is not treated on time, the patient may lose his eyes. Second complication is the small vessels of the kidneys, where it leads to a condition called diabetic nephropathy, where the kidneys starts losing proteins. Even this can be treated in advance, and we can prevent the kidneys from failing and the patient going in for dialysis. Lastly, the small vessels of the heart can lead to a condition called diabetic cardiomyopathy, where the patient can go into cardiac failure. As far as the large vessels are concerned, if a large vessel of the brain is affected, the person can get a stroke. And if the large vessels of the heart is affected, the patient gets an heart attack. And if it affects the limbs, then the patient can get limb ischemia.
So basically, it's affecting almost all organs of the body. So it definitely cannot be taken lightly, right?
Yes, exactly. So anywhere there is a blood supply, most of these organs can get affected.
So doctor, a lot of people have a doubt about this. What do the numbers on a sugar machine actually mean? And what is a safe range for most people?
For us to diagnose diabetes, the fasting sugar more than 126 or the post-lunch sugar more than 200 is called diabetes, and the hemoglobin HbA1c more than 6.5 is called diabetes. When we ask the patients to control sugars, we try to keep the sugars between 70 to 130 and the post-lunch sugar less than 180. We expect the HbA1c to be between 6 and 7.
So what is a HbA1c test and how is it different from a daily sugar check?
HbA1c is the glucose which is attached to the hemoglobin. Since the lifespan of the RBC is 120 days, HbA1c gives an average of the last 3 months of sugar control. Many times it happens that the person's fasting and post sugar levels are absolutely normal, but the HbA1c is high. That means at various points of time, the sugar has been high and that is picked up in the HbA1c. So it helps us to detect the people who try to get the sugar levels near normal levels when they come to us and they cheat on us, saying that they have been having a good control, but the HbA1c gets us to know that they have been not loyal to themselves.
So how often should a person with diabetes check their blood sugar at home?
That depends upon whether the patient is on insulin or tablets. If the person is on insulin, then he needs to check the blood sugars maybe more times in a day, every day, so that the dose of insulin can be adjusted. But if the person is on tablets and the sugars are very well under control, then he can check the sugars maybe 2 to 3 times in a week. That is enough. But if the person is having fever or is vomiting or there is any surgery happening or if the person is pregnant, then the sugars have to be measured more frequently.
So when do tablets for diabetes usually stop working and when is insulin actually needed?
So normally if the patient takes good diet control, exercises and medications on time, then the drugs can act for a long duration of time and they may not require insulin at all. But if the lifestyle changes are not attained, then the person's pancreas get exhausted of insulin and he will require insulin in 5 to 7 years of time.
So it's always better to act early.
Yes.
So doctor, is it true that taking insulin means that diabetes has become very bad?
No, that's not true. Starting the patient of insulin means the patient's insulin reserve is exhausted and we are replacing the hormone which is not produced in the body. The ultimate goal is to attain a normal blood sugar levels, maybe with medications or insulin. So the person should not pity himself thinking that his diabetes has become worse.
So doctor, as we all know, diet is very important. So what kind of diet actually helps diabetes and blood pressure, especially in an Indian context?
The diet which will be ideal would be a low fat, low salt diet with plenty of fruits, vegetables, lean meat, that is egg, fish, and chicken.
But a lot of people love snacking these days. So, what advice do you have for them? Are there any healthy snacks that are good?
Yeah, the healthy snacks would be oats and makhanas, which has got low calories and no oil.
So, how much and what type of exercise is usually safe if a person has both BP and diabetes?
The recommended exercise duration is 30 to 45 minutes of moderate intensity activity most days of the week. Now, at the onset, the person should not start jogging and all. He should start with a 15-minute exercise and gradually increase upon it.
So, can stress and poor sleep actually raise sugar and blood pressure levels?
Stress level increases the cortisol levels, which in turn increases the blood sugars. Lack of sleep increases the insulin resistance, and chronic worry increases the pressure on the blood vessels, thereby increasing the blood pressure. So, overall, if there is a lack of sleep and stress levels, both blood pressure and diabetes are going to be high.
So, doctor, what small daily habits can protect the body organs if someone has these conditions?
A person who has diabetes or blood pressure has to assure himself that he checks his blood sugars and BP regularly, take a good healthy diet, sleep properly on time, at least 78 hours of sleep is required, regularly exercise is needed, maybe resistance training also would be helpful, avoid alcohol and take low portion diet and avoid red meat, organ meat, and get regular eye, kidney, heart and feet checkup done.
Definitely. And I think if people follow this advice, there would be no diabetes. Is that true?
Diabetes will be controlled, but definitely the complications of diabetes will be averted.
But the people who don't have diabetes at all, if they are following a good lifestyle, will they never have diabetes?
If there is a genetic predisposition or if the person is overweight, they may get diabetes. But if they have a very healthy lifestyle, they are averagely built and there is no family history, definitely they will never have diabetes.
So, doctor, how does being overweight increase the risk of diabetes?
Overweight means there is increase of fat around the belly. Now this increased fat causes insulin resistance, which in turn raises the blood sugar levels. Also, these fat cells releases chemicals which raises the blood sugar. In India, even a moderately overweight like a BMI more than 23 also causes increase in the chances of getting diabetes. Even 10% reduction in the weight causes significant reduction in the HbA1c of 1 to 2%, and we will be able to reduce the blood pressure also by 5 to 10 millimeters of mercury.
So, at what age should people start getting screened for diabetes?
Normally, if there is a family history of diabetes or if the person is overweight, they should be checking their diabetes levels as early as at the age of 25. But since the incidence of diabetes in India is very high, any person should be getting their diabetes screened after the age of 30.
So, Dr. Prakash, it has been lovely having this conversation with you and getting to know more about diabetes and how we can prevent diabetes. What is one final advice that you would like to give our viewers on how they can prevent diabetes?
I would like the audience to screen for diabetes on time, eat healthy, do regular exercises, take medicines on time, and take care of the family.
So it was a very insightful conversation with Dr. Prakash Rai, and we have learned a lot about diabetes and how we can prevent diabetes. I hope you can follow this advice and prevent diabetes in time. Wishing you a very happy and healthy life. This is your host Aman Malhotra signing off. We'll see you soon in another episode. Thank you.